the right ventricle. So this little thing has to be the
papillary muscle.
No, it's that.
Oh.
thing nobody can remember. Starts with an M. Moderator band. That's it. So there's only one thing that should be coming from the septum over to the papillary muscle, and that's the moderator band. That thing right there. It looks like a string. It's really just axons. It's just Purkinje fibers that are in there. That's your moderator band. So all the ribs of muscle here, your trabeculae carni. So this is all right ventricle. You can kind of see the cords there and the cusp way up in here of your tricuspid valve. And here's your auricle. And if you open up the right auricle, you'll see there's your pectinate muscle. Kind of like a comb.
So that's where your left thumb is?
This is right auricle. Remember, the heart sits like so, and the auricles are the atria are very posterior. So this is one way of doing this one, and then this side, you start here, up towards this auricle, and you come all the way down, and then you open it back up so you can see all the left ventricle. So, totally up to you. That's one way you can do it. If you do it this way, let's go with this.
What is that?
If you go this way, you just kind of do a butterfly cut, and you open it all the way up like this. It's kind of cool. There's no wrong way to do it. You just want to kind of think, I want to see as much as I can. So you wouldn't want to cross the septum here. You'd want to go pretty close to it. Like I could have gone a little further over, and the fat tells you where the septum is, and I could have gone a little further over and I would have seen more. Your hearts will have the pericardial sac, so you'll have to dissect that off and pull it away. And then you'll end up with your specimen. So here's an example. First you get it on your tray and you flip it around and you go, okay, which is anterior and which is posterior. So pulmonary trunk's this large vessel that has this distinct angle. So it's kind of going to sit like that. So you put a rod in there and you force it in and you see where it goes, and it comes over here to the right ventricle. So that's your pulmonary trunk. Then this vessel here, very dense, and it's still, somewhat open. So that's aorta coming straight up. Actually, no. This is aorta right here coming straight up, and this branch over here is going to be brachiocephalic. So if I shove that down, that goes in through the valve into the left ventricle, so that's aorta, and then this branch touches, so that's brachiocephalic. And this is the way you figure it out.
The left common
On this one, no. One of these specimens does have several branches. This one does. Actually, this one has a few branches too that you can see left and right, common carotid. Just sometimes you get lucky. So posterior, here's your superior inferior vena cava, or vena cava, and it pretty much just looks like a T. So remember, those guys sit posterior, your aorta, brachiocephalic sit more anterior.
So on the models, though, the superior and inferior vena cava are up and down. And
yes,
is
on
that
the
just,
models, they're up and down.
Is
So
that
it's wrong.
in the human heart, it's up and down, and in the sheep it's different, or why is that?
That's a good question. It's not up and down. It's more like a T. Yeah.
So why did they say superior and
Just
do you
where
know
the blood's coming from.
Oh, okay.
You know, it's draining the superior portion of the body above the waist. All right, so this is a cool dissection. You want to peel off the pericardial sac and see what you can define first as far as the sulcus. See what great vessels that you can locate, and then start putting rods in there and determine what is that vessel. Are there any branches that are connecting to it? And then once you've done all that, then you can dissect it. And if you have one, you know, that comes out really good, or you have a branch that looks like aorta, that might be hard to tell. Kind of tore it up a little bit. Over here, that's probably aorta there. That's probably brachiocephalic, and then so we have these branches. So that might be vertebral artery. I'd have to stick a rod in there. So there's potentially a few little arteries. Most of the specimens I saw, though, didn't have too many great vessels. So there's no right or wrong way. You just want to, you know, dissect it so you can see the most information.